So sir, as you have given a talk on the relevance of triglyceride and series, so we would like to know whether LDL is not important as such.
This is a good question that has to be answered in a proper manner. We have been actually concentrating mainly on LDL cholesterol. We know that the evidence is available for the role played by LDL cholesterol, not only observational studies, epidemiological studies, experimental data, and even the randomized control trials which have gone to prove that by reducing the LDL cholesterol, you do get benefit in cardiovascular morbidity as well as mortality. So we are not going away from LDL cholesterol. We need to now concentrate that the 75% of the atherogenic particles are actually contributed by the LDL cholesterol. The remaining contribution is mainly made by the triglyceride rich lipoprotein particles. Whenever they are increasing, the triglyceride levels also are increasing. In fact, now the researchers or the scientists have been focusing their attention mainly on LDL cholesterol research activities, but forgetting totally about the triglyceride and its impact in cardiovascular system.
Okay, yes, sir. So sir, we would like to know what is the role of TGRLP as such in the atherosclerosis.
In fact, about 75% is contributed by LDL, but the remaining thing is contributed by TGRLP. The TGRLP means it is a triglyceride rich lipoprotein particles. They include one chylomicron, VLDL, and the chylomicron remnants, VLDL remnants. All these particles are now very important, considered to be atherogenic. Okay. So whenever you have atherogenic lipoproteins, so leaving the HDL cholesterol, the remaining particles are all considered under one label that is called non-HDL cholesterol, which includes not only LDL, IDL, VLDL remnants, chylomicron remnants, lipoprotein little a, everything put together. You call that as a non-HDL. Instead of concentrating on triglyceride, if you concentrate on non-HDL, that gives you much more information.
Okay.
The recent studies have shown that the non-HDL cholesterol is very, very important. It increases the hazard ratio for cardiovascular risk, particularly for coronary artery disease risk, when compared to LDL cholesterol in almost all statin trials which had involved people with the goal of LDL levels. People who reached the goals, in spite of reaching the LDL goals, they were still at a high risk of developing a cardiovascular disease. When you look at the hazard ratio for LDL and the non-HDL hazard ratio is very, very high, indicating that it is main risk factor for the atherosclerotic cardiovascular events.
Right, sir. So, sir, why, on what basis, especially we say that triglyceride is very, very important?
The thing is, we have normally encounter problems in our country. Our country is actually having the problems of obesity, we have problems of metabolic syndrome, we have problems of high triglycerides, low HDL with the increased proportion of small dense LDL cholesterol with increased ApoB particles on it, and so we need to concentrate on the entire spectrum of the lipid abnormalities which are seen commonly in our country, and that too the metabolic syndrome as well as diabetes. Both these people, they have the problems of high triglyceride and low HDL. There are many reasons why people are developing these triglycerides, because we are all rice eaters. Most of them are trying to consume a lot of carbohydrates. When they take a lot of carbohydrates, they tend to develop so-called obesity or metabolic syndrome.
Right, sir. So, sir, according to you, what is the role of fasting triglyceride in predicting the recurrent ischemic events?
The thing is, we were all depending mainly on the fasting lipid profile in the past, and we were trying to give importance to the fasting triglycerides. But now the studies have clearly shown that postprandial triglyceride levels actually do not vary much, in the sense about only 27 milligrams of increase in the triglycerides can be seen in the postprandial state. Okay. So doing a postprandial or a non-fasting sample of triglyceride is much more important than the fasting triglyceride. Fasting triglycerides may be important only when the levels of triglycerides are going beyond 500. Okay. Then you need to submit the patient for a recheck, in the sense ask him to come in the fasting state, give the sample, then try to analyze whether he has got a primary hypertriglyceridemia or a mixed dyslipidemia. Like that you can come to a conclusion. But most of us, they don't require a fasting sample, so we don't ask our patients anymore to come in a fasting state to get the lipid profile testing.
Okay, sir. Right, sir. So, sir, what key messages you would like to give to the practitioner as far as the CV risk reduction is concerned in relation to the triglycerides?
We need to understand that the LDL cholesterol has been brought down comfortably with the lipid lowering drug like statin. Even with the high dose statin in primary prevention, secondary prevention, or patients who had undergone a high risk group and then they were all submitted for a high risk group and then they were submitted for a high statin therapy, it has been seen that consecutively and consistently it has been seen that about 55 to 75% of them are still at a high risk of developing a cardiovascular disease.
Right.
That means you need to go away from LDL and look at other particles. What are important? One is HDL, the other one is a triglyceride. HDL, we have actually wasted our time. Many trials had come out and nothing has gone any sort of encouragement for us to continue the HDL rising so that we'll get a benefit in cardiovascular outcome, nothing. But we need to concentrate on triglyceride. Instead of concentrating on the triglyceride, better to concentrate on the triglyceride rich lipoproteins, which has got an impact on the cardiovascular morbidity and mortality.
Right, sir. So do you think that focusing more on the triglycerides is the way forward for reduction of the CV risk?
Now the thing is, we need to concentrate mainly on the non-HDL cholesterol. That's the key message what I would like to give it to you. Non-HDL cholesterol covers LDL plus triglyceride lipoprotein particles. So there is no need to concentrate separately on triglyceride. If you concentrate on non-HDL, it subsumes the impact of triglycerides.
Right, sir. Okay, thank you so much, sir, for your valuable inputs and key message for CV risk reduction in relation to the triglyceride.
So nice. Thank you very much. Pleasure is mine. This is a good question that has to be answered in a proper manner. We have been actually concentrating mainly on LDL cholesterol. We know that the evidence is available for the role played by LDL cholesterol, not only observed